Hi, everyone. My name is Anita Kilal, and I'm the Director of Education and Training at the Global Tuberculosis Institute. And welcome to today's webinar. We are going to get started in just a minute before I hand it off to our partners from Stop TB USA. Just wanted to make some general announcements. So everyone should be joining muted. So if you can just please remain muted until we get to the discussion or question and answer portion. Feel free to type anything into the chat and we'll be monitoring that throughout the webinar. And we'll try to address as many questions as we get. And I think those are all the announcements I have, and I'm going to turn it over now to Cynthia and Jolie, who will open up the webinar.
Wonderful. Thank you so much, Anita. Jolie, can we put up the slides? And while she's putting them up, I'll go ahead and start with, I've noticed that, Joy, it's not echoing on our end, so it might be that you have two devices open. That often causes an echo. All right, but we'll go ahead. So my name is Cynthia Champel. I'm a research scientist at Brandeis University, but my full-time, free-time position, as I like to say, passion, is as chair-elect of Stop TB USA. There's hardly a day that doesn't go by where I am talking TB with somebody. I'll pass it over to Jolie to introduce herself.
Hi, everyone. I'm Jolie. I'm an undergrad at Brandeis University. I'm the senior intern with Stop TB USA. I'm also chair of the media work group, and I'm on our executive board for our youth leadership board, which is our latest initiative. Yeah, I've been working in TB for over a year now. It's been crazy exciting, and it's turned into very deep passion.
Fantastic.
I will. Oh, Mythili has not joined us yet, but she's an intern with us as well and is also on our youth leadership board.
So let's go to Shaka.
Hello, guys. How are you doing? My name is Shaka Brown. I'm a member of the Stop TB USA, and we are TB, as well as a TB survivor from Washington, D.C. TB has been working on me, and I've been working in TB since 2013.
Awesome. Let's go to the tuberculosetics, Ria and Pragnia.
Hi, everyone. My name is Ria. Pragnia and I have been part of Stop TB USA for about a year now. We started as high school interns and now work on the youth media work group board to help with their mission of stopping the spread of TB and raising awareness.
Excellent. Thank you so much. Just a quick reminder before we jump into the slides and the training, because of the huge demand, we aren't going to do small breakout groups and consulting for the last half an hour. Generally, we have the training for an hour, and then the final half an hour was an optional session. We won't be able to do small breakout groups because of the demand. But we will have a general Q&A session if people want to ask specific questions about a piece that they've started writing during this training, because we definitely encourage this to be a working skills building session for you all. We'll take specific questions, and then we also have arranged 3 additional subsequent drop-in office hours for more one-on-one tailored technical assistance and coaching. So that's an option, and we'll post those 3 registration links, days and times in the chat box as we draw to the close of this first hour. All right, next slide. Here's the agenda for today. We're going to do, we've already done introductions, we're doing the agenda. We'll go into specific communication tips that are coming out of the research, the social psychology, social linguist research about public health communications. And then we'll get into specifics about one type of media communication, specifically the letters to the editor. and what it is about, what's the impact. We'll talk a little bit about other related actions that you can do. Then we'll talk about the whole, start to finish, like how to get started, what to do with that. And then we're going to train on a very useful, extremely useful tool we call the EPIC tool. And we'll use that to start drafting letters to the editors. And then, of course, the soup to nuts training here that you're going to get, what to do once you've finished your letter to the editor training. And then we'll ease into the Q&A session, the alternative optional half an hour that we have. All right, next slide. All right. We're going to start here with just a little bit of the intersection of lobbying, advocacy, and education, because you probably have heard of all these terms, and sometimes they're used interchangeably to mean the same thing, but particularly from the perspective of the IRS, they are not the same thing. So when I know a lot of nonprofits and a lot of government public positions really worry about the lobbying side of things in particular. And from the IRS's perspective, what constitutes lobbying is actually, they have two categories. We're not really worried about one because it's about endorsing candidates, and that's not what we're talking about at all around here. But the other part, like when you're going to talk to an elected official, a member of Congress, for example, what the IRS is really concerned about is if you are advocating for a specific vote, like a yes, no, or dollar amount on a budget item for a specific piece of legislation. That's it. It's pretty narrow. It's hard to jump into that. And that's why this Venn diagram is useful, because you can see that a lot of what people call advocacy, a little bit of it might be lobbying, sure, but a lot of it is straight up education, and then just energizing. The rest of it is dealing in that energizing, organizing kind of space. But even that doesn't trigger the IRS no-go zone, for example. Having said that, even nonprofits are allowed up to 20% of their budget in lobbying before they are at risk of losing their nonprofit status. So there's more give than a lot of people think. There's more actions that you can take than a lot of people think they can take. All right. And again, if you go into a meeting of Congress, let's say you run a TB department, right? You're the official TB controller for your state, and you go in to meet with Mitch McConnell because he's the minority leader in the Senate right now, and you go with one of us, right? You can give all the stats and figures about TB in your state or in the United States if you're giving the numbers, and not come against any advocacy or lobbying restrictions, right? That's strictly educational information that you're giving. And then you can turn the meeting over to one of us, for example, that have more freedom in our job descriptions / our free time to give the actual ask of, please include $225 million for the CDC TB division in fiscal 23 budget, for example. Okay, next slide. And so next slide. We wanted to highlight this resource for you from the Public Health Awakened. Government workers really can do a lot more than maybe sometimes they're led to think or believe that they can do. So there's more resources, including various data, actions, guidebooks, that kind of thing at publichealthawakened.com. And on the next slide, we're honing in on this graphic here a little bit to give you a little bit, for those of us who need special computer glasses to read. Here's the decision tree. Now, we won't go through the entire decision tree, and a special shout out to Shaka, who made it in this bigger format so we can actually read it together. But it's important to start off by saying, okay, am I representing my government as an official government worker, whatever your position title is, or do I have my personal free time, anonymous United States citizen kind of personal hat on, right? And then you can go through this decision tree and say, hey, is there an explicit for rule about not doing this. And then you can go through and see, okay, maybe not. Okay, I'm not sure. Let's do a little bit of digging. And then you can ask yourself, I love some of these questions like, are you willing to take the risk? Because some of us are and some of us aren't. It depends on, each individual personal. But there's also a question of like, are we overthinking this? And then let's go ahead and do this. But even if there is explicit, there's things that you can take behind the scenes, or as I mentioned before in the example earlier about pairing up with folks who don't have restrictions. So like survivors from the We Are TB organization, do a visit to your members of Congress with them, or your local state house leaders with one of them. I know results.org, anti-poverty advocates often know quite a bit about tuberculosis, so they can do meetings with you and let them do the final action and request, or the piece that would be considered advocacy or or lobbying. All right. So this will be in the slides. We will certainly share slides with you in the follow-up email after the session. Let's go to the next slide. All right, so here's, I've collected, you can tell I'm kind of passionate about this. So I've been going to a lot of webinars and trying to track as much of the brain studies and the particularly from the social psychology streams of research, and then how that gets translated into practical advice and some guidance for just public health communication in general. So this, again, this might be with your work hat on, it might be with your private hat on, that when you're talking about public health things in general, in a personal conversation, or with a presentation that you have, or again, like trying to educate and influence how public officials or decision makers are actually helping and advancing the public health efforts. Okay, let's go to the next slide. So one of the, I'll probably be referring to the frameworksinstitute.org quite a bit, because I find that they package their research in the most digestible way. So I'll borrow heavily from them. And one of the very first strategic framework analyses that they ever did was in collaboration with Demos, the Think and Action Tank, interested in progressive, anti-poverty type policies. And so they recently reiterated last year around a lot of the awareness of people coming to grips with the fact, like, oh, public health, the COVID stuff, there's a lot of public health workers doing things to try to help me, or in some cases, people are misinformed and saying I'm trying to hurt me with public health initiatives. And so there was a reminder newsletter that went out from Frameworks about talking about government from this earliest, some of their earlier research, that it's one of their conclusions. It was pretty clear that we definitely need to start telling a new story about government as an essential part of providing and protecting the common good. So it's always good to every sort of research project that they've done, they have found that eliciting the common good will help you in your messaging efforts. So there's that. And then connecting what government does is, because again, most public health departments are all part of some part of the government, right? But they say name specific. So it's highways, libraries, public health agencies, and this gives the brain of your listener something really physical, one to imagine in their mind. But also when you're thinking of concrete things, it makes the public health space, because in general, the average public member of the public does not really know. They have like this general positive feeling about public health, but they don't know who the public health workers are, and they don't know what they do on a day-to-day basis. So you want to name specifics and also give them something, a concrete visual that helps understand why we need resources to both build those physical things and concrete things, but also to maintain them, right? You want to emphasize the roles that only government can fill. So for example, the surveillance work that TB programs do on a regular basis. No hospital is going to do that for the entire population of whatever city or state, right? No for-profit company is going to do that either. Avoid the broken beyond repair trap. Yes, we've got problems. Yes, public health has been underfunded for decades, and we are desperately understaffed and underfunded, in my humble opinion. But what we don't want to trigger into the listener's mind is the broken beyond repair, because then they go nowhere. There's no motivation to change. There's no motivation to support you. There's no motivation to listen to your request or what you're advocating for. Then, one of the ways to do that then concretely is to focus on how to repair the public systems that we need to respond to collective challenges. So you acknowledge the challenges, you acknowledge, that things aren't where we want them to be, but here's the actions or how we're going to repair to get to this shared progress and prosperity. So those shared progress, prosperity, those are some key values that are widely shared that also keep your listener hanging in with you. All right, so here is a sample message that puts all of these suggestions into one slide right here. So Jolie, would you mind reading this example for everybody?
Absolutely. Our country's prosperity and quality of life depend on the public structures that we have created to keep society going. Structures like health and safety agencies have been put to the test during the pandemic, but their role remains crucial in keeping us all safe. Businesses, nonprofits, and individuals can all play a part in getting our country back on track, but only government has the reach and funding to properly and more equitably direct resources into vaccines, rollout, and economic recovery. Government is not perfect, but it can be fixed to ensure it works for everyone. We must continue to hold our elected officials accountable and work with them to heal and rebuild.
Thank you so much. And so you can see the brown, the blue, and the green match the three sort of key recommendations from the previous slide. All right, let's go into the next one. Now, here's some additional tips that they've been talking about. Getting back to the tangible examples, you want to connect with the audience. So the benefits of partnering with public health specifically, if you're speaking to business leaders, you're going to talk to them about, well, improved community conditions, whatever public health issue you're working on, in this case, tuberculosis, it's going to reduce absenteeism. Right? Or you could pitch to school leaders, for example, if you're doing a school health, you can say that better student health can lead to higher graduation rates and test scores. So you're really triggering the happy button of like, oh, here's what we can do together for that specific audience. So tailor the benefits that you want to talk about or the goals that you want to talk about to your actual audience. Again, connect with the core mission of other sectors. So those are some examples of how to do that. And again, there's a lot more advice here at the phrases.org resource site. Okay, next slide. Here again are a couple of screenshots that I took from a recent webinar that was it was a discussion. The first part was a discussion, but here you see Nat Kendall Taylor, who is the executive director of that frameworksinstitute.org that I mentioned earlier. So the quote was just kind of fun. It's a good reminder to me about speaking differently, including one thing that I've been hearing from the How to Change Minds from the psychology discipline is deep listening, right? So rather than arguing well, maybe we can switch that internal focus about, okay, I need to speak differently. That really resonates with my audience. And also part of that is keeping our listening our listening up. Now, this other slide that I took a screenshot of really, really struck me because it shows they've been doing testing on, does it increase the positive? Does it decrease the negative in terms of frames in public health, different public health messaging. So some of this was about smoking, some of it might have been child dental care, but they've been contracted, they meaning Frameworks Institute has been contracted to do a number of strategic frameworks analyses, and some of the key findings that they said that helps us not fall into pitfalls. Okay, so here's some traps. Unfortunately, I mean, we're not going to, some of you are probably going to definitely intuit this. And some of us are going to be very disappointed. So when using the Healthcare Heroes framework, what they found was that it triggered in the listeners the idea of individual responsibility. So it was obscuring the social determinants of health and the key system changes that we need to make. Health equity, unfortunately, in our polarized, folks who are working to polarize our society, has succeeded. So to the point where some audiences will definitely reject anything you say after you trigger health equity. And so I think I have another slide from another helpful webinar that NACCHO hosted, again, with some of the frameworks researchers on there, about how to talk about health equity without saying health equity. Similarly, they found that for some audiences, they can't use the word social justice anymore because it triggers that rejection based on polarization. So how do you talk about social justice without using the word social justice? And then this one was the biggest surprise to me, about talking about protecting the vulnerable, like, oh, this is the most vulnerable population. How many times have I found myself saying that or hearing that? Well, unfortunately, in the general publics as an audience, when they hear the vulnerable, they don't see themselves as vulnerable. So then that means it's others, which then leads to othering and stigma. So you actually decrease the likelihood that your general audience is going to be with you on a public health initiative if you start talking about, oh, we're helping the most vulnerable. Now, internally, that could be a totally different thing, right? Because if your organization is built around health equity, well then, talk about health equity all you want. But be aware that there are certain populations, certain audiences that you're going to have the exact opposite that you want using these messagings. Okay, let's go next. All right. So this was an example that came from that NACCHO training on the webinar, and I think you can find it on the NACCHO website still. I believe they archived it there. But so, for example, when she went into this, talking about a just society makes sure no community is singled out or overexposed to harm, because they did find that the idea of justice, similarly with the idea of common good, generally led to positive indicators, right? When you interview the people afterwards. They also found that speaking of unequal outcomes was not as effective as talking about unequal obstacles. And this is connected, I think, to another idea that we'll get to in the final slide about concrete examples, speaking about giving people a reason why this inequality or inequity exists, okay? And then a one-size-fits-all equal opportunity push wasn't as effective as talking about targeted justice. So this particular group has faced this particular unequal obstacle, so they need a slightly different, a tailored intervention, okay? Pair with collective solutions, right? Because if you just talk about the problem without giving a solution, or if you trigger that individualism rather than collective solution, that also won't be as productive. And sorry, it's not in the next slide, it's right here. This third point here, give a cause. Shine a light into the black box of why this thing that you're fighting, this inequality or this injustice or this inequity that you are fighting, shine a light into that. Now, you don't have to explain the whole, from the beginning, the whole reasons why. They found that you only have to give one cause, like one plausible cause of why we're seeing this and why what you're suggesting is going to make a difference. And folks stay with you much, much more at a higher level, and they're more willing to consider the action or the suggestion that you're talking about. Okay, let's go next slide. Okay, so now we're going to shift gears a little bit and go straight into concrete. We can keep all of that messaging ideas in mind. And again, we did the links to the webinars and things in the chat box so that you can follow up on whatever piece is most interesting for you. It's a practice like anything else. You just do it to get better at it. And so that's why we wanted to pair this information with a concrete skill building opportunity for you. And what we're going to start with are letters to the editors. But before we do that, it's good to like give a little orientation of the whole getting in touch with media outlets in the written format. And what are the impacts? Like, why would we do that? Well, LTEs are letters to the editors, and each congressional office interprets them differently. But I have personally heard from staffers who say, oh yeah, we read each letter to the editor as representing somewhere, you know, around 20 constituents or 10 constituents. Some even go into the hundreds because again, they're more, you know, maybe it's a bigger paper or they're a bigger district, etc. So it's really hard to overestimate the power of getting a letter to the editor published. And you're like, what? In this age of Twitter and Insta and all that stuff, like letters to the editors in like a paper still matter? And the answer is yes. And also you can think of, well, that kind of makes sense because think of the average age of the members of Congress. FYI. Okay, op-eds. Why are op-eds? Those are opinion pieces that are published on the opposite page as the formal editorials, or at least traditionally they were. So that's why they were called op-eds. And the impact is generally seen as more than a letter to the editor, but slightly less than a formal editorial of the paper or the media outlet. And that's because editorials often are interpreted, or most often are interpreted by members of Congress as worth the number of the circulation. So the New York Times editorial runs an editorial that's approximately however many tens of thousands of people sharing that opinion roughly. And so that's why that's very powerful, but that's a whole nother training. Okay. And all of them, another reason why we encourage people to take these kinds of actions is that all of them are a twofer, right? You're educating your fellow readers and you're activating and you're impacting policymakers. Okay, so that's some of the orientation. Now you know the codes and the impacts. Let's go to the next slide. All right, and we're just going to pause here for one moment. You've got a million things to do. People are pounding down your door. Why did you sign up? Why did you join this training? And it says you are part of Stop TB USA because we're hoping everybody signs up for our membership list. It's a really short membership form and you get a free monthly newsletter that is amazing. Jolie can put that link in the chat right now. But specifically, why have you joined this training? And what aspect of TB, I mean, maybe you're not here specifically about tuberculosis. I personally am right now. So what about TB or the issue that you brought here today really energizes you or really gets your gizzard? I might have just mixed my metaphor. All right, let's get in touch with that and then move on to the next slide. At which point, I'm going to hand it over to Ria and Pragnya, who have assembled these great how to get started slides.
All right, so before you actually start writing your op-ed, LTE, editorial, anything you do, there are a few steps you do to prep. So next slide, please. So before you even write your LTE, you have to pick out your media outlet. So that can be like any newspaper, like the New York Times or Seattle Times, any of them. And even your local paper, like I have a city newspaper that I often write to, and you can just identify what you want to write to and then move on because there are a lot of requirements within each media outlet. The guideline, if you search up in Google, whatever browser, search up guidelines, letter to the editor or op-ed or whatever you want, and insert your newspaper name, you'll find these requirements and you'll be able to start writing based on that. Then keeping those requirements in mind, then you write it and then obviously proofread and you can submit. So we've compiled a really short list of potential newspapers that you can write to submit your LTE to. These requirements, though, are very condensed and summarized. I would highly recommend using those links and referring to each individual newspaper, depending on which one you want to write to, because a lot of these will have specific guidelines about what to title, like the subject line of your email, or how you need to format the LTE, or if it needs to be a Word document or a PDF, or sometimes they require like an author's bio. So in addition to the LTE, they want to know a little bit about yourself. I know when I was submitting my letters to the editors to the Seattle Times, it was really important for me to read through the guidelines they had specific to the Seattle Times. And a lot of the times people won't consider the LTE unless those specific guidelines are followed. So while we do have this list for you, we would highly recommend visiting each site individually.
Fantastic. Thank you, ladies. And also, I will add a plug that it's great to get published in one of the big papers. So that's why we put them in there for you, because really they take letters, generally they take letters from all over. But do not underestimate the power of your local town paper. Like, members of Congress follow their hometown papers like hawks. So definitely there's a lot of impact that you can gain from writing to the local paper. All right, so we promised you a super practical skill. We call it the EPIC format, and you're definitely going to find out why. The reason why it's powerful is because it helps you write in a concise way, but having all of the required elements for really moving, informing and educating and moving your audience, whether it be a policymaker, a member of Congress, etc. In fact, I personally have used this EPIC format to write letters to the editors, to write letters to decision makers, to write op-eds that have gotten published, educating. So like, it'll prep my verbal comments when I meet with legislators in person, or laser talks when I'm getting the elevator. I even know in our state house, elevator 7 and 8 is the most common elevators to run into state house members in, and recruiting, or even joining, like asking people to join your activities. Okay, so everybody have their devices, writing devices, or their pens ready? Let's jump right in. E of EPIC stands for engage your audience. You want to, the best way to do this is to respond directly to something in the paper, because that first you have to engage the editor first before you engage the reader of the paper, unfortunately. So they're more likely to publish you if you're responding to an editorial piece or a front page piece or something else in the paper, in that order of priority, in fact. Now, a dramatic fact or figure or statistic can also be a good way to engage your audience. You want to try to invoke a common value to help trigger the broadest possible interest in your readers. And that's a lot of what we were talking about in the previous slides about the common good, or the idea of justice, or the idea of health equity, whether you use those exact words or not. 1 to 2 sentences are ideal. And so here we have an actual example published in the Seattle Times by our very own Ria. So I'll have Ria start by reading this one.
Okay, we need to be able to diagnose tuberculosis as fast as we can diagnose COVID-19 in order to adapt conditions according to diagnostic test results. In the same way that Thailand placed restrictions on communal activities upon rapidly diagnosing more than 50,000 new COVID-19 cases, effective diagnostics must be developed for tuberculosis so that similar preventative methods can be enforced in TB-prone areas. And then I have the little citation there.
Excellent. Okay, moving on to P. So EPIC, P stands for present the problem. Here you want to present as close to the root cause of the problem as you can get. Now there's a caveat, and that's that this is a spoiler alert. When you talk about a solution, you want to be able to have a direct connection, or have your listener make that direct connection. Give as many details as necessary. Sometimes a lot of details are helpful. Sometimes you can keep it pretty simple. And adding why you care about TB or the issue you are writing about, for example, can be part of that. It also helps generate a connection when you're personalizing your letters in any way. All right, let's have Pragnia go ahead and read this continuation of the example.
All right. Current diagnostic methods for tuberculosis are expensive, lengthy, inaccurate, and inaccessible for patient populations at risk.
Yeah, I mean, she did it in one sentence. Now, could she have expanded? Absolutely, particularly if she's going for an op-ed. You just expand each of these stages. Let's go to the next one. So I of EPIC is illustrate the solution. You want to give a concrete solution, again, that connects directly to the problem you were just talking about. And to the extent possible, paint a picture. What is it going to look like if you're doing that? But you also might use studies, reports, or firsthand experience here as well. Personalize the experience wherever possible. That's another way to continue to engage and keep your readers' interest. And the more concrete language you use, again, the more visuals people get in their minds, which helps them remember, or it sticks. It helps your message stick more. So continuing with Ria's actual published example, go ahead, Ria.
The World Health Organization has recognized the need for a rapid tuberculosis test in the End TB strategy by stating that all countries should aim to achieve the uptake of new diagnostics by following the plan's first pillar, integrated patient-centered care and prevention. A significant step toward achieving this goal is found in the work of the Global Fund Replenishment Conference to fight AIDS, TB, and malaria.
Wonderful. All right, let's wrap it up with our C of EPIC is call to action. Now that your audience is primed and informed and engaged, it is time to activate them. You want to ask for something timely and as specific as you can get. And again, it should match what you were talking about previously, right? So the audience should be able to draw a direct line from the problem that you presented to the solution that you illustrated to this call to action. In LettersT Editor, one sentence is best. Don't do more than two. So that's what you're like, hey, wait, I can write two sentences, right? I can write a sentence. So anybody can do this. Pragnia, why don't you finish up with this actual published example here that we're working with?
Yes. Urge your elected officials to follow through on the United States pledge by ensuring that the Global Fund's objective of raising $2 billion for fiscal year 2023 is met and appropriated for this next fiscal year towards saving millions from TB around the world.
Excellent. So there's a concrete dollar amount. It's a concrete time. It was published right in the beginning of the appropriations process in college or in Congress. So it was actually because it was April when this was published. So we have timely and concrete. Beautiful. Let's go to the next one. What? It's your turn now. Okay. Feel free to write questions in the chat box, but we are going to, we've actually, because we had so many people, we turned it into a mini test. So pop quiz. Let's go to the next slide. Oh, before we get to the practice round, we can go back. Here are a couple of sample calls to action. So for anybody who's actually, having the adventure with us live and actually writing a draft or taking notes on a draft they might do, marking bullet points is fine. Here are a couple of timely actions that are live right now. So Julie, can you copy and paste these in the chat box so people can have them for the rest of the session on their hands? And I used the senators from Massachusetts and my personal rep from Massachusetts. You can certainly swap out those senators and put in your senators or your representative. And then we'll move on to the practice round. So let me see if we have Maithili.
Hi, I'm here.
Yay. Okay, Mythili, why don't you go ahead and introduce yourself, and then let's go ahead and get the pop quiz started.
Okay. Hi, everyone. I'm Mythili. I'm a sophomore public health student, and I'm another intern at Stop TB USA. So this is the LTE that we went over together. I'll give everyone a couple minutes to go over it, and then we have a couple questions that you guys can answer. Okay, so the first question is, how did Ria engage with the audience? So A is, oh, sorry. I was reading the answer.
That's not bad.
Is there a way I can see when everyone has answered?
I'll close it in just a little bit.
Okay.
I'll give you just a few. All right, let's take a look at those results.
Okay, so great. Majority of you said that the answer was A and B, which that was the correct answer. Should we move on to the next one, or do we want to discuss it? Okay, we'll move on to the next. Okay, so the next question, it should pop up soon, is which statement is part of how Ria illustrated the solution? So answer choice A is Thailand placed restrictions on communal activities. Answer choice B is the WHO has recognized the need for a rapid TB test in the NTB strategy. And then answer choice C is ensuring that the Global Fund's objective of raising $2 billion for the fiscal year 2023 is met.
All right, let's take a look at those results.
Okay, so again, majority of you did answer B, which is the correct answer. The WHO has recognized the need for a rapid TB test in the NTB strategy. And I believe that could be found towards the beginning of the LTE. Okay, so the last question is, what is the call to action? So the first answer choice is readers should communicate with their members of Congress to support $2 billion for the Global Fund to fight TB, AIDS, and malaria. And then answer choice B is readers should attend the Global Fund Replenishment Conference. And then C, the WHO should give the readers new TB diagnostics. Okay, so it looks like everyone answered A, but I believe the correct answer is C, which is the WHO should give the readers new TB diagnostics.
No, it is A.
Okay. Oh, it actually is A. Okay, sorry,
Yeah,
I
yeah.
had the wrong answer.
It's all good.
Okay, so 95% of you answered correctly, so great job.
And these aren't I love the fact that everybody, the vast majority got the call to action. And it also points to how we can always keep improving our communication, right? To try to make it as clear as possible and make the call to action as concrete as possible. And I mean, on the second question, A, I can totally see why people chose A, for example, because it built up to the solution, because, 2 steps away. So this is fabulous. Thank you so much for engaging with us. And then next slide. We wanted to just say a couple of extra tips on what to do when you've completed your letter to the editor. Take it away, Jolie.
Yeah, so once you've written it, it is time to submit. Please, please, please follow all the guidelines that you had researched before writing it. That just increases your chance to actually get it accepted and published. So go ahead and submit. But the most important thing is to follow up with that paper, to keep an eye on what you did submit. They won't always let you know that it was published. So you're not going to get a note from the editor saying, hey, it was published today. You have to do that yourself. One thing that I like to do is to set Google Alerts. You can also subscribe to the paper, pay for that little subscription so that you can keep an eye out. Sometimes they're free. Hopefully they're free. You know, sometimes you just have to Google your name with it every single day with, you know, Cynthia Champel tuberculosis, although that would might give you quite a few results. Try your name with the name of the paper. Keep an eye on it. So if it does get published, let us know. So the function of the media work group is to keep TB in the headlines. We want to respond to these letters to the editor so that, you know, it's at the top of everyone's minds. We want it in the headlines. We want it brought to the attention of members of Congress. So this way we can help keep it alive. We can submit things in response. And you can also tell your friends and family to read it, to keep an eye out, to also write a letter to the editor using this framework. Just keep in touch with us. There's our email in the chat, and we'll throw in a few more emails a little bit later on. And let's just hop back on over to the decision tree, take another look at it before we start to move on.
Yeah, and here the idea is, well, okay, now that you have some concrete tools and there's so many actions, there's so many different ways for you to reach out and, you know, again, just education, but maybe education and a little push to serve your folks. And if you have like a local city, maybe your restriction is not going to come to bear if you're actually talking about federal, you know, just or writing a personal letter to your member of Congress or personal email to your member of Congress at the federal level, or vice versa. If you have a federal level, you know, maybe you can talk to your local public health department or the state house folks, and that won't be a big deal for your employer in that respect. So again, just we're hoping to really emphasize the fact that no matter where you are, where you work, or what restrictions your workplace puts on you, there is something you can do to move forward and improve the public health besides your day-to-day, which thank you for your service. All right, next slide. All right, here we go. Wrapping up. We're going to transition now. I think we're a little ahead of schedule, so that's very exciting. Here are your 3 office hour opportunities. So let's say you started a piece, or you're like, no, I have an idea. Here are the 3 registration links. They are individual. These are going to be drop-in office hours. So literally you can drop in for 5 minutes and just ask this one question. You're like, I have my whole letter to the editor written, but I'm just not sure about X or this one thing. Drop in, ask us. That's great. If you have a drafty draft, you're like, can somebody just eyeball this? That's great. If you actually want some one-on-one soup to nuts, again, it won't take us more than half an hour, I don't think. If you bring your topic, you know, what you're really passionate about, and yeah, we can walk with you one-on-one and hopefully submit by the end of the office hours. So we have coaches online. You can see that we have an amazing team. I think you've met most of them today. And so go ahead and pick the time that works best for you and register right now. But we also have time now. We're scheduled, we have the Zoom link open until 2 o'clock. So for right now, we'll take general questions and specific Q&As. All right. oh yes, another plug to sign up for our newsletter, and then you'll get, it's only once a month, and you'll get the occasional call to action. You'll get and always the open invitation to join us for more actions in terms of, if you have a project that you're really passionate about, propose a working group, because we do most of our work through ad hoc working groups, like the media work group members that you've met today. And this is one of their projects, this training. Ooh, okay. We already have exciting questions pouring in. And this point, we you can feel free to unmute yourself and ask your question live as well. Sheila, do you want to ask live, or do you want us to read it?
Thank you. I've noticed that NIH does not have a lot of support for TB work. I'm talking to various institutes. And I'm wondering if there's any sort of work going on behind the scenes to encourage NIH to devote more resources to TB. And if so, is there specific asks that we can push for in our?
Yeah, that is a fabulous question. And Shaka, I would love to hear, because Shaka's just gone to a couple of big campaigns, the 2-4. Shaka, are you still on? Sorry, I'm putting you on the spot. I didn't prepare him for this.
Yes, I am here.
Do you want to talk about some of the bigger campaigns that we're talking about? And I will just add, before you, just the meetings that you've been attending and some of the actions that they've been talking about. As an example, Sheila, one of the things we're pushing for is vaccine. So you could do research in terms of which agency or institute under the NIH umbrella would be most likely to support a TB vaccine, like what Operation Warp Speed did, although nothing will be like Operation Warp Speed probably ever again. And you can call on leaders to push for that. You can ask your members of Congress to do that, or you can actually write letters directly to key decision makers that might be able to have, if they have discretionary monies. But for NIH, I suspect that there's some guidelines from the congressional appropriations budget that they have to fulfill. So starting with your members of Congress might be the best too. Shaka, what would you add?
Well, you just answered everything that I was going to. I don't know specifically. A lot of times there's things that specific money comes from very specific resources, and so what we usually do is we go for like the big ticket stuff, and then let that trickle down. I'm not sure what goes to NIH versus CDC, but someone else might be
but in terms
better idea of that.
In terms of the new regimens, right? Because you've been to a couple of meetings recently on the new regimens.
Yeah, the 14624.
Do you want to say a little bit about that?
That was, we were sharing TB survivor experience in the importance of shortening the drug regimens. While sometimes people may say like, oh, there's a cure out here already, so what is the problem? You know, sometimes getting the idea of what the cure represents and what the change represents, going from 4 months to 1 month, or going from 18 months to 6 months. And a lot of times folks don't have the strong idea of just like what that physically looks like if we have to hold pills in front of their face, or if we have to talk about what one loses if you have to do something for 18 months nonstop versus doing it for 6 months, how much those things change people.
Mm-hmm.
So that was a big campaign that they were pushing for, and they got a lot of sign-ons from world organizations in that aspect.
And in fact, the RIA and Prognia are working on the diagnostic side of things. And so that might be another area of research request that you might follow up on. And it might take a little bit to tailor it, but RIA and Prognia, do you want to talk about your diagnostic and just what the diagnostic need was that led to your idea?
Yeah, so we started out, we found out that the World Health Organization was meeting about, they had these whole consortiums and they were meeting with the big people talking about inaccessibility in developing countries for TB tests. Some people weren't coming back for further testing when it was painful, and there were transportation issues, and for some people it's just too expensive to pay for them. So we started working with our local university and TB Research Center that was local as well. And we started researching just through literature search in the beginning, and then we started talking to other experts in the field, verifying our ideas. And we started tackling this problem to create a painless, effective, accessible test that, if created on a larger scale, could help, address this World Health Organization need and ultimately help those developing patients that were really in need of this. Even now, there's still no viable test that that can be administered. Right now, we're still in, we're about to go into our testing phase, and hopefully we can advance that idea further to bigger organizations. And like Shaka mentioned, just because treatments are available, the diagnosis part of that is so important so that people aren't like suffering with symptoms for months or years with no accurate diagnosis delivered. So when we reached out to the University of Washington, this was our freshman year, the professors at the Tuberculosis Research and Training Center kind of voiced this need that people don't have a rapid test. And so our idea is to create something kind of similar to a urinary test that pregnancy tests normally take on the format of, so that patients don't need to go through a bronchoscopy or a chest x-ray or like travel miles to a clinic just to be told that they don't have access there to rapid tests. And so if patients just need to urinate on like a lateral flow assay, then there's no need to be punctured with needles and all of these probes and tests for something that should be a simple diagnosis.
Mm-hmm. Yeah. And Sheila, so these are a couple of ideas. One is for the NIH to take on developing a rapid at-home point of care test for TB, which we still don't have, which is ridiculous. An effective TB vaccine is something else that we desperately need if we're ever going to get to TB elimination here or abroad. And, building off of what Shaka was talking about, that campaign to get to the shorter regimens, but why can't we have a 10-day Z-Pack for TB? Like what about, instead of months, what about let's go to a 1-month treatment for active TB, right? So that's those are like 3 scientific areas where the NIH could be a game changer. And I will say the power of this collective action, one example is that you may not know this, but the Department of Defense has a specific body of medical research, like technical medical research that they get from Congress. And in the authorizing language, they had drafted dropping tuberculosis from that list. And collectively, we requested that they add that back in because those are research, like hard research dollars to advance the fight against TB. So what we're sharing really does work. Like we do get impacts, and we'd love to follow up and maybe workshop a more specific, because timeliness is important. And so that's why right now the season is in appropriations, which is the process by which Congress passes its actual spending bill. So how much every year are we actually going to spend on X, Y, Z? And often, as Shaka mentioned, they're higher level amounts, and then it's up to the individual division directors, or like in the case of the CDC, they say how much goes to the TB division versus the other divisions. And so there might be a particular communication that you want to work on, or communication campaign that you want to work on, that focuses on that head of the CDC in terms of, hey, you just got X, Y, or Z money from Congress. How about using a little bit more of it for X, Y, or Z related to tuberculosis? So hopefully that answered your question. I know at least in part. But we, maybe drop in on one of the workshops, or depending on how this next half an hour rolls, maybe we can start workshopping it now, or, toward the end of this session. Okay, who else has questions? Comments, conundrums? We explained everything perfectly? Okay, with that then, Jolie, can you go to the extra slide of the other LTE from our friend Willie Dickerson in Snohomish? Yeah. So here's another concrete example. And one of the things that I wanted to point out about this example is that we illustrate that you want to put your name, your home address, and your phone and your email, one or the other, but preferably both. I think a lot of papers require the phone number. They never publish it, but what they like to do is to have the power to call you to confirm that it was in fact you who wrote the letter to the editor. And they often will not publish it without that information, but again, they won't ever publish your phone or your email. Some don't publish any part of the address, others publish the town, because more and more we have local papers that are actually cover 2 or 3 towns, or they frequently receive communications from 2 or 3 towns, or they'll put the neighborhood, if it's a slightly bigger town where there's strong neighborhood identities kind of thing. So that's one of the tips there, but you can see another super concrete example. And if you count the sentences, 1, 2, 3, 4, 5, 6, it literally only takes 6 sentences to educate however many hundreds of people that read, or hundreds or thousands that read. This was actually, the New York Daily News. Wow, okay. Hundreds or thousands of people, or tens of thousands, in the bigger papers, of people that read that paper. And also, I know Willie he's a fellow volunteer from results.org, a great anti-poverty organization. He gets published every single week because he writes. He's retired now, so he writes all the time. He's often really good at mentioning the specific members of Congress's name in the letter to the editor. Now that is harder to get published, but it definitely, you can guarantee that your member of Congress is going to read that if the name is there, because every office in Congress actually has an aggregator service that is combing through all media sources and trying to scrape up mentions of their name. So that is again, it's such a huge impact for the amount of effort that goes into it. All right, let me pause there and see if we have any other questions. All right, let's go ahead and put up the times again for our drop-in office hours. And then if you want more than just a 1-session type of support, maybe you want to join our media work group. And because, we're quite informal, we have a lot of fun. You've already met how great these people are. And we tend to, if we don't have a lot of business, like when we're planning a training, we like to just sit and write and help each other write. So that is a great way to build your writing skills as well, if you want to come join us. Ooh, nice. Shaka has a question for anybody else in the audience. Has anyone here submitted a letter to the editor before or gotten something published before? Because thank you, Shaka. That is a great question. We'd love to hear your story. No one? All right. Well, because they were waiting for the training, Shaka. All right. Okay, with that then, we will wrap things up. Yeah, hopefully we can, you've got enough ideas and enough energy to go. I mean, definitely think of yourself as having a support group, because whether you join Stop TB USA or not, this is part of the work of the media work group at Stop TB USA. So we'd love to connect, you know, we'd love to, you know, even if it's just a one-off, helping you write a letter to the editor. One other tip is keep, because editors really like publishing letters that respond directly to things that they've already printed in their new media outlet. You may want to skim the headlines or the front page, or just skim the opinion page, because I guarantee you, you can connect tuberculosis to anything. I mean, give a topic. This will be a party trick one of these days, a party game. Like, give me a topic, any topic, and I'll connect it to tuberculosis in like 3 sentences or less, right? Especially, you know, in inequity. Oh gosh, just so much. The whole COVID situation has expanded both the need, the urgency, but also the number of points of connection that people now have, because, you know, we were all learning about epidemiology, we were all learning about vaccines, we were all learning about how bugs spread, airborne disease, droplets versus, you know, airborne versus etc. So literally, you know, just maybe that's your 3-minute morning practice, is scanning the op-ed pages of your local paper, or the paper that you read or like to read. And if any hook comes up, then you can jump on it, or call us and then jump on it, and we'll write a letter to the editor together. All right. Thank you, everyone, so much. We really appreciate your time and your work and your attention to these issues. Keep caring and keep up the great work. And we will send you an evaluation, actually. Julie, can you post the evaluation link? I forgot to mention this. Because this was done in the meeting style of Zoom, it won't automatically give you the evaluation button like a lot of webinars that you close out. So we'll post the link to the webinar, or to the evaluation here. It's only 7 questions. We try to keep it much shorter than your average evaluation. And we'll also resend the link to the evaluation in the follow-up email with that will also have those drop-in office hours links for registration as well. All right. And if all of this just went by so fast, you're just like, whew, my head is spinning, you want to just get in touch, it's leadership@stoptbusa.org. So you can also email us anytime. Thank you so much, and take care all.